Okay, well, I'm Dr. Silber, Sherman Silber, the Infertility Center of St. Louis, and we really have a treat right now. This is Jennifer, who, at 24 years of age, I'm right on that,
Yes.
right? Came down with a terrible case of leukemia. They thought she was going to die, but just to be safe, in case she lived, when she did, and was cured, we would freeze her ovarian tissue. So that was like 20 years ago. And this is the first case that we ever did, and we're the only ones right now really actively with a program in the whole United States. And it's been a long time, and we didn't know that we'd be able to transplant the tissue back, and we didn't know if we could culture the tissue. And here she is now. We had her on Facebook Live several months ago, and she was happily pregnant, and now look what we have. Now she's 44 years old, if I can reveal that, with a 24-year-old ovary, and a beautiful baby. What's her name again?
Madeline Grace.
Madeline Grace. So let's see, Madeline Grace, can we see her in the, yeah, there? She might cry you took away her bottle, but I don't know. Madeline Grace and Mom and Dad.
Hi.
And this is, to me, is a miracle because I knew Jennifer as a young girl, and the big question was she going to survive her 2 bone marrow transplants for leukemia? And she became a cure. And but in case she was cured, which she is, she was going to be totally sterilized by her treatment. So we took out 1 ovary and we froze the tissue, transplanted it back, so she's got a 24-year-old ovary, and she got no IVF, right?
No IVF, all natural.
Oh my gosh. So there she is with the baby.
Yeah.
And she can have more babies, really, because she's got a 24-year-old ovary, and if she runs out of that tissue, we got more ovary tissue in the freezer, so we can always transplant that back. In
right.
fact, when she's 100 years old, we could give her a 24-year-old ovary.
Oh.
Maybe that's too extreme.
We'd be making history again.
Yeah. So tell us how it feels.
It's great. It's very exciting. I think that it took us a little while to get pregnant, but and some of that was a little hard at times, but you know, we just kept trying, and it paid off. So we have Maddie was born November 24th, but she was 2 months early. She came right when we were 32 weeks. So and she's still hungry.
And she had a great obstetric care.
Yes.
Because, I mean, she was premature, and not because of the ovary transplant, it was just the luck of the situation, toxemia. But, so she had to be delivered early. But look at, I mean, great OB, great pediatricians, and that's what we expect nowadays in the modern world. So
Yeah.
this is fantastic.
She did great. She's gained, she's doubled her body weight. She was 3'4" when she was born, 3 pounds 4 ounces, and she's 8.5 pounds now, so a little over actually.
You're very brave. I mean, you went through a lot. I mean, it was 20 years, and when we saw you, you were in temporary remission. That was important.
Yes.
Your oncologist, in fact, told us if you're going to take out the ovary and freeze it, the time to do it is when you're in remission, which we did. So there's no cancer cells in it, and then you just braved 2 bone marrow transplants.
It's with the same donor.
With the same donor, and you were pretty sick.
Yeah.
Yeah.
And wasn't sure that this would ever come to fruition, but it did, thankfully.
Yeah, and you became menopausal and completely
Yes.
sterile.
Mm-hmm.
Yeah.
Because of the radiation and chemo.
And I didn't know you were going to want to come back to have the tissue frozen until I bumped into you at a zoo event.
Yes.
St. Louis Zoo, right? Yeah, right.
So, yeah, when we decided we were going to get married, we knew we wanted to at least try. So,
Wow.
we had the ovarian tissue transplant October of 2013, and then we were married that December.
So this piece of ovarian tissue, which is only a quarter of your tissue that we froze, has lasted maybe 4.5 years already. Is that right?
Yeah.
So that's pretty good, because the ovary tissue, even though it's a small portion of her ovary, will last longer than if she had her whole ovary intact. Because as the ovarian reserve goes down, the rate of what we call primordial follicle recruitment goes down, and so the ovary has a way of lasting longer if there's less of it.
Oh.
And so this tissue will last way longer than someone might have predicted by, I mean, it's really basically 1/8 of what was a whole ovary. And so you would have expected it to, a whole ovary to last maybe, or 2 whole ovaries to last maybe 25 years from when you had it frozen. And here we have 1/8 of an ovary that's already lasted almost 5 years. So you can do the math and realize that we just get more bang for our buck, shall we say, when we have a piece of ovarian tissue than a whole ovary. So, because you still have 3 pieces of ovarian tissue that are just as good that are in the freezer.
Yeah.
Did you have confidence this would happen? I mean, I'm so thrilled. I wasn't sure what would happen. I just knew it was all we could do 20 years ago.
He was very positive. I think I was very optimistic. But then because it was taking longer than what I had thought it would.
I see.
So while there was still hope, but it was, I would kind of go up and down a little bit. I wasn't.
You would get frustrated.
Yeah, it took a while.
It took 3 years.
Yeah,
for us
and I was encouraging you.
Yes.
I'll tell you, when you've had bone marrow transplants, there's been some irradiation of your uterus and some impact. So I think that at first we were worried that there'd be no implantation because of uterine side effects. But actually, we found that if we wait long enough, they get pregnant. I mean, despite the fact that it's a lower implantation rate because of the uterine receptivity, you do implant because you got a very young ovary, the eggs are fantastic, and eventually you have an embryo that does really implant, and you have a baby. That's what we've discovered. You're typical, really.
That's the first time I've ever had that.
Yeah, first time you've been called typical, right? Yeah, right. Yeah, so I was really confident sooner, you went through a lot, I was confident sooner or later you get pregnant, because that's what we're finding out. We're finding out over 75% of women that are cancer survivors that have had ovary tissue frozen and transplanted back, over 75% get pregnant, and we only had 1 miscarriage, and so it's a very low miscarriage rate, but the live baby rate is fantastic. We have 1 cancer survivor that has 4 babies from her transplanted ovary tissue already. 4. And 1 has 3, actually. 1 leukemia patient has 3. And you're among the very first leukemia patients that have babies from ovary transplant. It really works. But you're a lesson that Dr. Pincus was right. You're an oncologist. If you must take the ovary out and freeze it when the patient, after her chemo, the patient's in remission, but the ovary hasn't been destroyed. I mean, the developing follicles have, but the resting follicles have not all been destroyed, and that's when you take it out, because there's no cancer cells then.
Yeah, we got very lucky.
And then 20 years later, you transplant it back.
Yeah, that's all.
Yeah, let's let her say something. Let's let Madeline say something.
Are you ready?
Because she's kind of whited out on the screen. I want people to be able to see her really, really well. She's a little bit whited out on the screen. Oh, look at her. She is really fantastic for she's a 3-week-old, and look at how alert she is. Wow. Could be she's even more alert because she had those 2 months in NICU, and so she experienced the outside world earlier than most kids do.
Yeah.
And she's incredibly alert, really, really, totally healthy.
She's a
That's
very
exciting.
happy baby. So
Happy baby.
usually smiles, except right now we're just taking it all in.
Yeah. Well, I'll tell you, that early smile, I saw her smile. That early smile is really important for development, because that early smile attracts the attention of everyone. And so that interaction with people, because she's smiling, look at her smile, that interaction with people really is a good quality vicious cycle, and that she develops intense awareness because people are communicating with her. That early smile is really important for childhood development.
So, yeah, she smiles, she doesn't laugh yet, but not yet. But, yeah.
I think she's good for food right now.
Yay!
Now, when you went through your 2 bone marrow transplants and you were sick as can be, were you confident or were you afraid you weren't going to make it?
I felt like I knew that I would. The second one was a little bit more scary just because I had gone through it already.
Yeah.
But just that will to get through was still there. But after the second transplant, I was really, really sick. And it took a while. But I don't think I ever questioned I wasn't going to get through or pull through. It was just a drive that I had that I knew I was going to pull through.
So young cancer patients like you are rightfully confident nowadays that they're likely to be cured. It's amazing, really. But what scares them isn't the cancer so much, I found, is the possibility of being sterile, the likelihood of being sterile. Was that your situation?
That was the first thing I asked after, when I was first diagnosed in the doctor's office, and they took me straight to the ICU at the hospital. Once the doctor came in and laid out the plans and told me the diagnosis, of specifically what type of leukemia it was, and then, like I said, came in and with the plan of what we were going to do to tackle it, my first question was, am I going to be able to have kids?
Yeah.
And that was really, because at that point I was 23, and I knew I wanted to have kids. I knew, I had my future lined out at that point. I knew I wanted to be a teacher. I knew I wanted to have kids. That was my whole goal. So that was forefront, because I had already decided I was going to make it. I was going to pull through.
I remember you were the front page of the St. Louis Post-Dispatch, which was a very highly circulated paper at that time. In those days, the newspaper era, and it was quite a story. It was shocking that young American St. Louis woman has her ovary tissue frozen. This is really kind of a thrilling moment. Have you talked to your oncologist, Dr. Pincus, about all this?
He hasn't seen her yet. We haven't really taken her out just because with flu and RSV right now. But
this is her first trip to the outside, huh?
Pretty much. Pretty
great.
much. So the little limited amount that she will go out, like maybe to grandma and grandpa's, but it's very limited going out. They've told us we just have to be really careful with the flu being so high like it is.
Yeah, and luckily I got over it finally. I'm okay now, but you got to be cautious.
Well, and I had gotten in touch with it as well when she was in the NICU.
So did you have it?
Yeah,
oh my God.
New Year's Eve. That was awful.
That flu this year is a killer.
So, but we just take the best precautions possible right now with her. And with us teaching before we come in, clothes are left outside in the garage to make sure no germs come in.
Yeah. Well, then we're honored that you came in to let us see her.
Thanks
But nobody here right now is infected, so okay. Well, I think your story is going to be very inspiring, because two things. One is when young women find out they have cancer, whether it's Hodgkin's, leukemia, lymphoma, or whatever, they all are worried about what you're worried about. And to see that you went through it and you have your family, even 20 years later, is going to be very inspiring and will really help these young women emotionally, because that's what they seem to care about most. Also, it may help that oncologists, unlike Dr. Pincus, usually they don't give a darn about your fertility. They want
That's
to cure
true.
you, and they don't want anything to get in the way of that. They don't understand a woman's feelings, that a woman wants to carry a baby. And so actually how did you get referred to us? Most don't get referred because the oncologist doesn't want to waste his time with it. Or
It was through Kathy Klebert. Actually, it was Dr. Jarrell, and
okay.
who was with Dr. DeRosa,
Right.
and Kathy Klebert, who was my bone marrow coordinator with
See, that's
Dr.
what-
Pincus.
See, the nurse is usually the one that will say something, but the oncologists don't. So hopefully some oncologists will see this, and we'll get the message out, because there's so many women that are being sterilized by their cancer treatment and are very, very sad about it. Actually, it's a tiny number of women who were cancer survivors who were referred for freezing their ovarian tissue so they could preserve their fertility. It's a very, very small number, and that's a tragedy. So you'll be an inspiration.
Well, and hopefully too, because a lot of times for female patients, that might be their driving force to try to help them get through their treatment too, is that
Yeah.
idea.
Yeah, in other words, they can tolerate going through misery because they know
Right.
they have their ovary frozen, and they can really look for the future. They know we're planning on the future.
Right.
We know we're
Right.
planning on them surviving.
And that's a huge driving force too. So.
That's an important message.
so.
Well, okay, now,
now.
you understand, I told you this before we did this interview, that you're not going to be number one anymore.
Oh, I'm okay with that. We got a new number one around.
Yeah, exactly right. And it's better to have girls than boys, too. Your girls call you, they stay with you. The boys, you have to call them and bug them, and then they don't answer you, and they have comments like, "Oh, Mom, I'm busy." Girls will call you every day, when they're grown up.
Did you hear this?
They'll communicate with you. Much better.
Say hi.
Although if you have a boy, it's okay too, but girls are better.
He
All
set the
right.
stage for
Good.
the
I think
next.
that's a good interview.
Yeah, ready for number two?
Yeah.